Things to be aware of is that, on average, when you look at bipolar disorder, people tend to spend two-thirds of the time in two-thirds of their mood episodes. I shouldn't say spend two-thirds of the time. But two-thirds of their mood episodes are depressed episodes. It's more common for them to be depressed than it is to be manic. Now, having said that, like I just mentioned a minute ago, I know that there are patients, and other doctors too, have seen patients who just had only been manic and not depressed, or only hypomanic and not depressed. So I'm giving you averages. It doesn't mean everybody's like that. The reason that's important is because, as I mentioned, depression can look exactly like major depression. And you may not ever see, if you don't see the mania or the hypomania, or if the family, or if there's no family history of bipolar disorder, which is key, all you see is depression, and the person goes in to their doctor, they get an antidepressant. What does that do? Treats their depression, right? It's good for that. Well, unfortunately, the doctor doesn't know that they have a tendency to go up in their mood too high, and they start on an antidepressant, and then boom, they get manic. I really think this is a problem with kids. There are a lot of kids, I think, that get started on antidepressants, and the physician, you see, they've never had a manic episode, so the physician wouldn't know that they have a tendency to be that way. The only other way to know is just a family history, and that's not guaranteed. But the child comes in, or the adolescent usually comes in, and they're depressed. They get started on an antidepressant, and then I think what happens in some cases is that they go ahead and get either manic or into a mixed state, which is the one I just described. And a significant number of them have suicidal thoughts and things like that. It's a very miserable state to be in. So it's a difficult thing, and it goes back to the whole problem with psychiatry. We're not advanced enough yet to be able to do a blood test and say, you have bipolar disorder, you have depression, plain depression, unipolar major depression. If we could ever get to that point, that would eliminate that problem. We would know exactly what to use for treatment in a person that came with depression and had a tendency for bipolar disorder. Okay, so I wanted to mention a couple of things. I think that when I would see patients, the things that were very, very important that I think that everyone should know that wants to know anything about bipolar disorder. One is sleep is incredibly important. Okay, if a person that has bipolar disorder doesn't get a good night's sleep, or if they don't stay on a good regular sleep cycle, going to bed at the same time at night, getting up at the same time in the morning, if they don't stay on that good sleep cycle like that, look out, because the person could become manic or depressed, really, and it basically makes the illness worse. I've had a lot of folks with bipolar disorder who work night shifts, and then they on their nights off, they may do that 4 nights a week, and then the other 3 nights they want to sleep at night and be awake all day. That is terrible. That wreaks havoc on their illness, and I don't care how much medicine, anything else I use, they're not going to be very stable with doing that. So sleep hygiene, we call it, is incredibly important. So that means, not taking caffeine right before you go to bed. Don't exercise right before you go to bed. Don't take stimulants of any kind, cold, non-drowsy, cold pills, whatever. On to another concern with bipolar disorder. About 50% of people with bipolar disorder will have some addiction to some substance, whether that's alcohol, or other illicit drugs, some substance. 50%, that's a lot. We think that there's probably some underlying problem in the brain that puts the person at risk for the addiction process, but also causes the problem with the mood swings. The way I think about the mood swings is that I tend to think that there's some limiter in our brains, in all of our brains, that judges how high and how low we go. There's some circuit, let's say, that does that, and I don't know any science behind this, but let's say that it's a possibility. And it just seems like somebody with bipolar disorder might have their limiter set too high and too low, so their mood swings way higher and way lower than somebody who doesn't have it. Stress is a very important trigger for mood. We've talked about that a lot. It's not good for anything, really. It's not good for the brain, so it's not going to be good for anybody that has any type of illness of the brain. It's going to make their symptoms worse. And usually what happens is they get stressed, like all of us have happened. We get stressed, we don't sleep as well, and then bang, the mood gets worse. So again, it comes back to the sleep as well as the stress. Now, a couple of other things. Be really careful if you know somebody with bipolar disorder, be very careful and caution them to be careful taking any medication that they're not sure what's in it. I have had patients who I don't think really have bipolar disorder but got manic on things like Adipex or diet pills of some type. What do diet pills do? They increase metabolism. They stimulate you, right? If you burn off more, if your metabolism's higher, you're burning off more calories. But the problem with that is you could get pretty hyper, you know. And if you have bipolar disorder and you do that, you can go into a manic state. So watch things, even things like caffeine, but also things like pseudoephedrine, which of course everybody knows about now because they're having to put it behind the counter to prevent methamphetamine labs from using it. But anything stimulating, you want to be very careful. If it says non-drowsy on the box, be a little bit concerned about taking that if you have bipolar disorder. Okay, now, speaking of medications, I wanted to mention for a second, what do we use to treat, you know, bipolar disorder? If we know somebody has bipolar disorder, what do we use to treat it? And the sort of the classic treatments for bipolar disorder are what we call mood stabilizers. Now, mood stabilizers, it sounds like it'd be easy, but there are actually several different kinds of mood stabilizers. Some are actually seizure medications, medicines that help calm brain activity down, and it sort of makes sense. It calms the brain activity for a seizure. It can also calm the mood swings down. So that's medicines like valproic acid or Depakote, Tegretol is another one, and there are several other newer ones. But those two have the most studies that have been done with them. And there's also one called lithium. It's not a seizure medicine. Lithium is an element, actually. It was studied back in the 50s, and it was found that it calmed down mice. So they were actually wanting to use it for a sedative. Turns out it's an excellent treatment for classic bipolar 1 disorder. It can have some side effects and toxicities, and like any medicine, you have to think about the risks and the benefits of taking the medicine. And if the risks are worse than the benefit you get, then it's not worth taking it. But those are some sort of examples of medications to use. Interestingly enough, when we talked about depression, we talked about electroconvulsive therapy, or ECT. It's an excellent treatment for depression. It's also an excellent treatment for bipolar disorder. Those are the two disorders that it really is the best for. It works for some other things too, like Parkinson's disease, but it doesn't work so well for schizophrenia or substance abuse or anxiety disorders or things like that. So ECT is another possibility. Something to keep in mind with bipolar disorder is, and this is very important, I should have probably mentioned this much earlier, but the more times somebody swings in their mood, the more times you have a manic episode or a depressed episode or any combination, the more times you have those in your life, the worse course the illness is. What that means is, if you've had one manic episode, it's easier to have another one. If you've had two, it's easier to have another one. And each one that you have is a little worse. It can last a little bit longer, and it can be a little harder to treat. So the goal is, if you find something that works, to stay with it. The problem is, like I mentioned earlier, is if you're manic or hypomanic, you may not think there's anything wrong, and you don't want to take a medicine that's going to take away your energy and your need and your lack of need for sleep and things like that. And I've taken care of an artist one time who said that with the medicine, it takes away her creativity. She couldn't create art like she was before. And it's a give and take. You got to decide, okay, do you want to create art or do you want to be able to function in society? And that's really what it comes down to. It's difficult. That's a tough thing. But the goal really is to stabilize the mood so that the person doesn't have such a risk of having these severe mood swings. And like you mentioned, it's a bit of trial and error when it comes to medicines. Again, it's hard to know what's going to work for one person and what's not for that person. It's a bit of trying the medication, giving it some time. Like you mentioned, you have to give them time because they don't work fast, any of them. And then seeing what works for the person. And sometimes there'll be somebody that comes in and they've been on 5 or 6 medicines, and I'll just ask them, and maybe they've been on everything, and I'll just ask them what worked the best for you. We try that again, we see how that goes. If that doesn't work, then we try ECT or something else. It can be pretty tough to treat sometimes. But with treatment, by the same token, I had one lady stable on lithium for 30 years. She'd been on it for 30 years, had no problems. As long as her lithium level stayed where it should be, no problems. Her mood was just like this. Okay, so that pretty much takes care of that. Now I wanted to read real quick one more little thing about Van Gogh. This is just a little description of his life, really. I mean, it's not terribly long.